The nasopharyngeal airway, more commonly called the nasal airway or NPA, is a disposable, uncuffed plastic or soft rubber tube used to maintain a patent airway in a patient with a gag reflex. The nasal airway is considered an airway adjunct because it must be used in conjunction with manual airway maneuvers such as the head tilt chin lift. The nasal airway may be used in conjunction with an oxygen mask or bag valve mask. It is strongly suggested in any patient who requires assisted ventilation but still has a gag reflex. The design of the NPA is unique. NPAs vary in length from 17 to 20 centimeters. The diameter ranges from 20 to 36 French. At the proximal end, a funnel-shaped projection and ring help prevent the tube from slipping inside the patient's nose. The beveled distal end makes it easier to insert the tube, while the airway's slightly curved design allows it to follow the natural curvature of the nasal pharynx. When in place, the NPA rests between the tongue and the posterior pharyngeal wall, thus maintaining an open airway. Nasal airways should be considered for any patient whose ability to maintain a patent airway is in question, but who still possesses a gag reflex. The patient may have an altered mental status or be unconscious, though typically the gag reflex is lost in an unconscious patient, and an OPA can then be used. If the patient should start to gag during insertion of the NPA, immediately stop the insertion. Caution should be used when inserting an airway in a patient with suspected facial trauma and is usually contraindicated if you have any reason to suspect a basilar skull fracture. If you meet resistance during the insertion process, withdraw and gently try again or switch to the other nair. Do not push or force the airway. Considerable trauma could result. Now let's look at the steps involved in using this airway adjunct. Take BSI precautions. Place the patient in a supine position if possible, with the head in a neutral position. Select the proper size nasal airway. When measured, the airway should extend from the tip of the nose to the earlobe or tragus. A tube that is too long could enter the esophagus and cause gastric distension and/or inadequate ventilation. Apply a water-soluble lubricant to the NPA before inserting. A training mannequin was used for the following steps of this procedure. Insert the airway with the bevel, the angled portion of the tip, pointing towards the septum, the wall that separates the nostrils. Slowly insert the airway into the nostril. By slightly rotating the airway from side to side, you may make insertion easier. At no time should you ever force the airway into the nostril. If you meet resistance, remove the airway. Apply more lubrication if needed, and try inserting it into the other nostril. If the patient begins to gag at any stage in this procedure, immediately stop advancing the airway and remove it. Stop advancing the airway when the proximal ring has come in contact with the nostril. Assess the patient's breathing. Apply supplemental oxygen or begin ventilations as necessary. If the patient's level of consciousness improves and a gag reflex returns, the airway may need to be removed. This can be accomplished by grasping the proximal end of the airway and pulling it gently out. Suction should be available during this process since patients sometimes vomit during the removal process.